Hello, and welcome to today's episode where we explore the systems that keep our healthcare world spinning and sometimes wobbling. I'm your host, Daniel, and today we're diving into a topic that's complex, controversial, and incredibly relevant: the risks of implementing a diagnosis-related group, or DRG system in Malaysia's unique dual healthcare landscape. First, let's set the stage. In Malaysia, we have a dual healthcare system. There's the public healthcare sector, which offers free or heavily subsidized care to citizens, and the private healthcare sector, which operates on a paid model with regulated professional fees for doctors. Now, imagine introducing a DRG payment system, but only in private hospitals. DRG payments provide a fixed, standardized reimbursement for treating specific diagnoses or conditions, regardless of the actual costs incurred. This can drive efficiency and cost control, but it also carries significant risks when applied in a system where public and private healthcare coexist. So, what happens to private hospitals under a DRG system? The first challenge is balancing fixed professional fees with fixed DRG reimbursements. Private hospitals have limited wiggle room to adapt if costs, like medical supplies, staffing, and technology, rise. They're under pressure to manage costs strictly, streamline care, and discharge patients faster. This need for efficiency might sound good on paper, but it can lead to unintended consequences. Private hospitals may focus on admitting patients with simpler, low-risk conditions, the cases that fit neatly into DRG categories and are less likely to exceed reimbursement limits. More complex, costly cases, they may quietly shift those patients to public hospitals. Here's where the public system feels the strain. Public hospitals, already managing high caseloads, might see an influx of patients with complex conditions that private facilities are reluctant to treat. This can lead to overcrowding, longer waiting times, and stretched resources. While private hospitals optimize for efficiency, public hospitals may struggle to cope with an uneven distribution of high-risk cases. This imbalance could widen the gap in quality and access between public and private care. Those who can afford private health care may enjoy shorter wait times and efficient services, while others face delays and inconsistent quality in public facilities. Let's talk about the people who matter most, the patients. In private hospitals, DRG incentives to discharge patients quickly can lead to early releases. Without proper follow-up care or home support, there's a real risk of complications and readmissions. Even with regulated professional fees, patients might face higher out-of-pocket costs for services or amenities not covered by DRG payments. This makes private healthcare less affordable, pushing more patients to the public sector. And for patients with complex or chronic conditions, they may struggle to access care in private hospitals altogether, facing limited options and longer waits in public facilities. So, what's the big picture? The introduction of DRG payments in private hospitals could fuel competition and drive innovation, which is great, but only if the system is carefully managed. Effective regulation is crucial to prevent cost-cutting that compromises quality. We also need to ensure public hospitals aren't overwhelmed by high-risk cases that private facilities avoid. Collaboration between the public and private sectors could help balance the load. Partnerships, shared services, and referral pathways might reduce pressure on public hospitals and ensure that patients get the right care in the right setting. In the end, DRG systems can improve efficiency and care delivery, but in Malaysia's dual healthcare system, they also carry risks that we can't ignore. The challenge is to strike the right balance, ensuring quality, affordability, and fairness for all patients, regardless of where they seek care. Thank you for joining me in today's podcast on the potential risks of implementing DRGs in Malaysia. If you found this episode insightful, don't forget to share it with your peers. Until next time, stay informed and stay healthy.